Record. Beautiful. Okay, welcome to my presentation on okay, let's start that over. See, I get so nervous when I start talking. Okay. Yeah, okay. All right. So, welcome to Echo Ridge, and thanks for joining us on this call today. Today's call is to answer questions about the school Echo Ridge, but it's also to answer questions about the landscape of osteopathy. So, I'm going to just quickly go over what we're going to be covering today. We're going to do a little introduction. I'm going to introduce you to my guest who's here, Jenna, who is an advanced osteopath working out of Vancouver who has an extremely excelling practice, who's got beautiful insights and also has a bit of a different perspective that I'm really excited to share. I'm going to cover what osteopathy is. That's the biggest question that I first get from people is what is osteopathy? We're going to talk about the landscape of the profession itself because it's not as cut and dry as you might think, and it's really hard to get all of your answers. Why would you want to become an osteopath? But also, why would you not want to become an osteopath? Because you may finish this presentation and say, that is not right for me, which in and itself is huge. So if you come out of this webinar with something, then I'm happy. We're going to go over an overview of the actual academy itself, what this program is, and a little hint. We do something different, which is what we call tissue melting. And we're going to explain what that is. And then we're going to do some questions and answers. Now, I have more people who can't make the call than can. I've got a whole list that just were coming in saying, hey, could you please send me this recording? So if we don't answer your questions today, shoot me off an email at info@echoridgeacademy.ca. Show up on your screen. And let's jump right in. First, I'm going to introduce myself. So I'm Denise. I graduated with kinesiology. It's actually a fitness and lifestyle management program in Toronto back in 1995. And it was a wonderful foundation program that I took. It covered, the basics of anatomy, EKG testing. It was it was wonderful, wonderful information, but really wasn't the career I wanted to do. So I jumped into massage and I graduated from Sutherland Chan in 1997. Now, as I got into the career, I jumped in right away. I started working at the University of Toronto Athletic Center. I did a small bout there before moving back to my hometown. And it was a wonderful experience. So I got to do those quick 20-minute treatments. And man, oh man, it was exhausting. So anybody who works in sports knows this well. Go to an event and see patient after patient after patient, and they're all wanting deep tissue. You were just trying to prove yourself. No way I was going to do that. But I also got some experience at Lyndhurst Hospital for spinal cord injuries. That was an eye opener just to see a completely different type of injury, a different type of like feeling flaccid tissues. And I spent quite a bit of time working with pregnancy and infant massage, which came in really handy when I had my daughter because I started massaging my babies as soon as I came home from the hospital. It was incredible. But then I found, I got into practice and I wanted to do more. I wanted to take more. I had an insatiable appetite to learn. So then I started taking more courses. So I took craniosacral. I actually started right with Grace Chan, who was an osteopath. Now, back then in 1997, we really didn't even really know what osteopaths were. Did they exist? Of course they did, but they weren't really overly relevant in Canada. And then I started taking courses like visceral manipulation. I took a program called matrix repatterning. I did kinesiology taping. I mastered low level laser therapy. I had a whole clinic running. At one point, I had 6 machines and we were just go, 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 go. So much fun. Learned a ton. I added in ultrasound, shockwave, Bowen therapy, literally anything I could get my hands on. Still wasn't enough. So then I took a program called Primal Rekinetics. I did advanced myofascial. I became a Reiki master. I did energy matrix dynamics. I did strain counter strain. I did all the stuff. I took all the courses. I took all the classes. So at this point in time, I'm like, well, I'm already working like an osteopath. Why don't I go get the designation? So I did in 2016. So 9 years after practicing, I still wanted more. I wanted to do more. Like I was missing something. I wasn't really in flow. I wasn't getting the results I wanted to get. And I found that I was kind of overqualified as a massage therapist, but underqualified to kind of do anything else. And I thought, well, hey, if I go get my osteopathy, at least now I could call myself an osteopath. why does this matter? It's actually really important because I landed exactly where all of most massage therapists land. I ended up completely confused. What do I do? But I was also exhausted. I ended up being completely overtrained. So I'm like, okay, how am I still struggling when I have all of this knowledge? I have all of these techniques. I have all of this stuff. I had a thriving practice. And I'm like, what do I do? I ended up getting completely burnt out. And so what did I do? I started teaching. I taught in RMT programs, osteopathic programs, and I started mentoring therapists. But I still felt like there was a piece that was missing. And I'm like, what is happening? And so, why does this matter? It matters because if you're watching this, you're going, yep, get it, get it, get it. And I can maybe see some aha moments here of the early therapist going, are you telling me that if I take all the courses, I'm screwed? I'm like, no, that's why I'm here. Because as a massage therapist, I took osteopathy. But other people go into osteopathy that are not massage therapists. Maybe they were, maybe they came out of the kinesiology program. Maybe they're nurses. Maybe they're Ayurvedic. Maybe they come from a completely different background. Well, those people that come from a different background, they have a completely different experience than the massage therapist. So, in order to answer these questions that you have today, because I know I've had so many people coming to me saying, hey, I'm seriously thinking about taking osteopathy because I am so sick of this. I'm treating 25 people a week. I'm exhausted. My body hurts. And if somebody asks me to do another deep tissue massage, I am going to scream. So maybe I'll just go take another course so that I can get out of this rat race. I'm not making enough money. Everybody wants a 60-40 split, which is not enough money to survive on, not as a massage therapist, because you're tapped out. Then you overwork, you get sick, you get tired, you take time off. And then you're like, I got to do something else. And you end up in this horrible conundrum. And so I'll take osteopathy. Now, I'm going to say, yes, this is a great option, but I really hope you don't do what I did, which is become an osteopath, but not really know what to do with it, how to position yourself. I find that osteopaths that are not massage therapists actually do better than the massage therapist who take osteopathy. And we're going to go through why. The only way I can answer that why is to talk about osteopathy itself. And we're going to get into the landscape of osteopathy. So if you have some questions, start writing them down. Hopefully, I answer them over the next hour. If I don't, just come on in and let me know. So, osteopathy, the landscape has changed since 1997 when I started. More people are becoming aware of what osteopathies are. They're becoming aware that they exist. Insurance companies are covering osteopathy, but there's a whole bunch of stuff happening there that I'm going to jump into and explain. And osteopaths charge more money. People are willing to pay more. And quite frankly, it's because they get results. Why are they getting results? Well, we're going to get into that as well because it's kind of cool as to what's happening. Okay, so the big change is before I can tell you really what's changed, I really want to go into the history of osteopathy because I do find when I get talking about osteopathy, we kind of spin ourselves in circles. So, what I'd like to do is set the tone for those of you who have no idea, sort of even what it is we got to go back to where it started. Where did it begin? So we're going to look at when it began. And the story actually begins in the late 1800s. So we're going to go back and do a little bit of a quick, hopefully we'll make it quick, history lesson. So it all started with a fella named Dr. Andrew Still. So he was the one who coined the term osteopathy. But originally, he called himself a magnetic healer. What does that even mean? We're going to dive into that. So he had two children and they both died of meningitis, and he became obsessed with natural healing. Now, Dr. Still was a medical doctor who he was at his wit's end. Like, what do I do? Like, this isn't working. Now, in this era, what I want you to kind of picture in your mind is in this era, drugs were getting pushed, surgeries were being performed, not necessarily for the best result of the patient, but they were still learning. So they were really experimenting with people. And I've got a grandmother, God bless her soul in heaven, who had more surgeries than she ever should have had. And the whole family said, I think they just experimented on this woman because that's what they did. They needed to learn. So what happened is Dr. Andrew Still said, whoa, back off. Like these drugs are causing more harm than good sometimes. So he started really getting into maybe we can do more manual therapy and help the body in its own healing. So he said, the body kind of heals itself. Why aren't we tapping into that? Why aren't we going back to that? So I'm going to do a side note for you. Massage therapy was just Swedish. I want you to remember that. This is going to be really important. And massage therapy was just gaining steam at this time. And it was more of a general health, circulation, immunity, help the body to recover from injuries. And it was in Sweden, which was big on gymnastics. So the massage therapists then are not the massage therapists today. The massage therapists back then were actually often nurses who were doing a lot of help post-war. They were saying, hey, maybe this mobility is a thing. Maybe this is important. But they really weren't diving into what we dive into today. So we're going to come back to that. But first, we got to go back to osteopathy. So Dr. Andrew Still, medical doctor, also natural health. Now, what did Dr. Andrew Still do? Well, he called himself a magnetic healer. That was not going to work in the medical field. He was not going to get any respect by saying, hey, I use my intuition. I just tap in and I get the blood moving. I get things, shifting and the body is healing itself. And I'm noticing that when I do this and this and this, people are healing faster. They're not needing those medications. But he couldn't say that. So what he did, it's very brilliant. We love Andrew Still. What he did is he created a new name. He called it osteopathy. Osteo, bone, pathy, as in how the body heals. And he created principles. So instead of like Swedish massage was techniques, right? We're gonna like basically the human body is a big giant loaf of bread and we're gonna knead it and we're gonna push blood flow and we're gonna work those muscles because that's where your pain is. And we know trigger points really well. That is where a lot of pain is, but we've learned so much more because it's not actually coming from that, but we can get into that later. We got to go back to the principles of Dr. Andrew Still. So what he said is, let's keep this very clear. It's going to be based on principles. So those principles are four principles. The body is a unit. Okay, mind, body, soul. Well, doesn't everybody believe in that? They say it, but do they actually do it? How many practitioners can you go to, say, chiropractors, massage therapist, whoever, and they say, whoa, 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 your mental health is just as important as your hip pain. Your emotional health is just as important as your neck pain. Your spiritual perspective is going to dictate where you're going to go. They're all connected. So everybody says, oh, I work mind, body, and soul. I work holistically, but they don't because nobody's taught to. And quite frankly, a lot of massage schools are going to say, you don't deal with emotions. You don't deal with this and you don't deal with that because that's not in your scope of practice. But yet you hit a trigger point and that person starts crying and you're like, ah, what do I do? What do I do? Okay, I'm not equipped for this. Don't know what to do with this. Maybe you should go see your counselor. Okay. Then this is and this happens to us because we spend an hour with somebody. And when you release all these trigger points, you are moving energy. And when you move energy, stuff comes to the surface. We know it. We don't know what to do with it. So what do? I'm going to work on the structural stuff, which is fine, by the way. You know what? I'm just going to work on sports injuries, or I'm just going to work on this, or I'm just going to work on this because I'm not equipped to deal with this. I don't want to deal with this. I refer out. Nothing wrong with that. But you at least have to acknowledge that it's there and know what to do in that situation. They don't teach us that in massage school. So then the second principle is the body will self heal if given the chance. Now, you break a bone, we're not going to say, oh, we can just, self heal that. No, it's not going to work. We send them to the ER. So we do need and use our modern medicine. However, nature is always our first defense. You don't just jump to drugs. What can I do for myself first? Or if I'm on a medication, how do I get myself off this medication? Maybe never. But if I give my body a fighting chance, it will start to self heal. There are some keys in there that nobody talks about that we do talk about in our program. The third, structure and function are interrelated. Now, we all do this. Chiropractors do this. Um, we've got acupuncturists do this. Massage therapists, nah, we don't really jump into that. Essentially, what they're saying is that how your arm moves, how your hip moves, how your neck moves is going to be related to how your organs are functioning, how you're breathing. Is there blood flow even getting to that shoulder? Because if there's no blood flow getting to that shoulder, you can go in and work on that shoulder all day long. It's not going to get better. And maybe something in here is affecting the neck, which is affecting this. So, how do you know? A, how do I figure that out? We teach you. B, how do I know where to go? We teach you. They're related. We can use the range of motions of the body to assess and find things. It's so cool. It's so much fun. And it makes you look like a genius. And there's different ways you can do it. There's different kind of muscle testing you can do, and there's actually extra courses you can take that work on this principle. But if you don't understand the principle, but you go take the course, you're going to come out and you're going to use their 10-step method instead of tapping in going, how do I use that for myself? We teach you how to do that. The last one is for Dr. Andrew Still is the artery is the rule of supreme, which basically means you need blood flow. Duh, of course we do. So if you've got a damaged shoulder and you're not getting any healthy blood flow in there, I don't care what techniques you do, it's not going to heal. It's not going to happen. So we need to get blood flow there. So what do? We go in and we work that shoulder and we're doing this and we're doing that. But if the plumbing is clogged somewhere else, blood flow is still not going in. Now, what about the nervous system? Well, this is why we might go a bit beyond osteopathic because we want to look at the nervous system as well. We'll get into that. All right. So hopefully you're with me so far. My beautiful girl Jenna, I've got her on speaker here. Does she have anything she wants to add before I get into a quick history? Next, I'm going to jump into the really quick history on how Andrew Still came to be.
Um, Hi. Yeah.
Hey, welcome. Thanks for being here.
Thanks for having me. Yeah, no, I mean, I think that's all like pretty clear. I'm those people that did not have a massage background before I went into um osteopathy. My pathway to osteopathy was a bit different for sure. And so we can chat about that a little bit later. I'm more of a process kind of person. So I really like the principles and the tenets of osteopathy. And then I build those principles and tenets in my assessment and treatment process. So it does take a little bit of time to integrate. Like I've mentored other people who you're either currently students or they're new grads, and then they're like, I don't know how to take those principles and pull it into the treatments that I was already doing. And so I've helped them develop their own process and way of thinking of pulling things together. So we can probably talk about that a little bit later, but yeah,
Oh,
I'm
thank you.
happy.
And that's beautiful. And that, that actually touches on a really key as to why I'm actually only training massage therapist because it's even harder for the massage therapist because I find that if you're not a massage therapist, once that clicks in you, you're like, oh, I get it. But massage therapists, we have a whole other beast that I'm going to get into. And I do find, which I'm going to talk about later as well, is the reason why I'm opening up this school is because I've taught at the other schools. And what happened is I ended up mentoring them because they didn't teach integration. Now, that was everybody. That wasn't just massage therapists. All of the students, I had nurses that I worked on, I had Ayurvedic, I had all kinds of different practitioners, and they come in, they're like, what are we doing? And I'm like, they're not teaching you how to integrate the techniques. So we're going to get into that as well, which is one of the big things that I'm doing with this school. Anyways, okay. So before we go into that, I do want to just quickly go into the history because I want to give you a bit of a picture again as to how we got to where we are today because it really does matter and everything will come full circle. So let's get into our little bit of history here. Jump into my little slide here. Awesome. Here we go. So we're going to go back as far as Hippocrates 450 BC. Okay, we're going before Jesus here. But it's important we do go back to Hippocrates. He believed in karma, he believed in food is your medicine, and he treated subluxations. So let's talk about chiropractic adjustments, subluxations. They were being used 3,000 years ago. Okay. Then we bring in Jesus. Well, Jesus was faith is what heals you. He truly saw people. Now, depending what your religion is, and you may not, wherever you're at, that's fine. But I am kind of just looking at this as a whole, is that, I'm just explaining what he did, is, he would dive into divine intervention, right? So, which brings us to Dr. Still. He said he's a magnetic healer. There's some similarities in there as to what was actually happening. And there's a reason why that's really important. And not just him, we've got other amazing healers that have come in. And how does that heal? They're all doing the same thing. So it doesn't really matter what the religion is that you're bringing in. We're bringing in energy, and we're going to talk about energy later. But then we kind of moved past that and we started getting into our modern science. Our modern science actually starts like 200 years after Christ because we started treating manually, started treating wounds. This is the beginning of our medication era. But it was like 900 years, really, like between Galen and Avicenna. There's like, that's a lot of years where not a lot happened. This is what I want you getting to, this is what I want you thinking about is you've got a lot of years. What about all the years pre? Like we only record, we are in 2025. Well, that marks the day from Jesus' death and beyond. So we have to bring him in here because he's our timeline. That's what we use. Regardless, put religion out, everyone writes the date down. That's what it's based on. So you got pre-Jesus, you got post-Jesus. But there was all kinds of stuff that was happening that we didn't know, like we didn't apply, that they didn't know we have today. So I really want to get you thinking about, what's really going on here? All right, let's carry on. So then we're going to just fast forward another, I don't know, 500 years. And Andrea Belgium started dissecting human bodies. And that was the beginning of, let's really see what's going on in here. And then we've got a fella, Ambrose Pare, who was the father of modern surgery. So it was the 1500s, started cutting people open and, going, hey, let's see what's actually going on in here. And then they started training surgeons. And then back in the 16 to 1800s, families were too poor to go to doctors. So they had something called bone setters. And these were literally people, when you broke a bone, they'd put it together. And that's who you saw. But then let's move, like now, I want you to keep in mind there's all kinds of stuff happening around the world. I'm giving you a very fast snapshot because I need it to prove my point. Then we go into Sweden. And that's when we go into the 1700s, early 1800s. And he was the father of physiotherapy, right? And we've got massage going on in the background over there as well. We're going to move forward a little bit to Grey's Anatomy, right? Everybody knows the Grey's Anatomy book. Well, we owe that to the late 1800s. This is why I want you to think about, okay, 1800 seems like a long time ago. 1825 to 1925 to 2025. It's only 200 years. And we're going back thousands of years to say healing has been happening. Okay. That's modern. I'm going to say the 1800s is actually pretty modern. But then Robert Jones pulled manual therapy and surgery away from the bone setters. Now, they did actually mentor them. So it's not like, they weren't having, the best hygiene and they didn't really know a lot. So they came out and said, let's train you. Then they started training surgeons. Oh, hold on, I'm on the wrong page here. Here we go. Okay. So we've got all that training happening. Things are starting to move. Surgeries are happening. There's all kinds of stuff happening in the medical world. I'm not going to get into all of that, but I wanted to bring you to Andrew Still because I want you to take a look at Andrew Still in the late 1800s, and he's a doctor. And it's only been really a couple hundred years of modern science, where they would call modern science. And he was saying, hey, whoa, 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 what about all of the old stuff? So let's go back all of those years. We're going to go back before, like before our time, before, Christ, before our existence of what we think of as, 2025, pre-2025, there was all kinds of stuff happening that they stopped using. So he was tapping into that. He's tapping into, there's so much ancient wisdom. There was so much that they were doing. They might not have understood why they were doing, but it worked. And he's like, hey, we need to bring that back in. We need to blend it in with our medical world. That did not happen, unfortunately. But that was his intent. So his intent was to say, hey, let's bring some manual therapy into the medical world. So then what happened? Things split. This is what's really important to know about osteopathy is things didn't go exactly the way he wanted them to go, but he was still pretty happy about what happened because he still got to train people in what he knew was really good. So he brought in a fella called John Martin Littlejohn. So this is the early 1900s. And he brought it to Europe. Now, this exploded in Europe. So if you go to Europe, it's a whole other world of osteopathy, which we can talk about later. Now, back in the United States, now Andrew Still, I will side note if I haven't told you, he's in the United States. And a fellow named D.D. Palmer in the United States, he didn't train with Dr. Still, but he did work with him a little bit and they had a good relationship and they were friends. He created chiropractic. Now, he said, I'm going to focus on the nervous system, not the circulatory system. So let's think about this because people always say, what's better? Chiropractic, massage, osteopathy. Well, hold on a second. What's better? Your heart surgeon, your, I don't know, your endocrinologist, like your specialist. So what's happened is it started to like specialize. All right. So now what we've got is we're only working with the nervous system. That's our thing, is the nervous system. Great. Right. He went on, he created chiropractic. He also did claim that a lot of it was intuitive when he came through. If you do a little bit of history on chiropractic, and he kind of just took Dr. Andrew Still and he took it to another level, essentially. Now we still got massage and physio is starting to gain steam, okay, back in Sweden. And from there, we've got osteopathy is principle based. We got chiropractic, we got massage, we've got all these different types of therapists. And the reason why I want you to see this is because my next point is where we are today. So, where we are today is not where Andrew Still was in the 1800s. It is not where the chiropractors were in the 1800s, and it is not where the massage therapists were in the 1800s. So, for anybody today to say you have to only work as Andrew Still says, and it's a principle based, and you have to just stay with Andrew Still. Okay, well, maybe we can go back to old medical practices while we're at it. That's not going to work. So there's a little bit of hypocrisy happening in there. And when you were hearing Jenna before, she's saying, well, hold on a second. I'm principle based, but I'm techniques based. So we're going to show you how they come together. Okay. So a principle based is going to say, well, you're not getting enough blood flow to that shoulder. So let's work on the viscera and the blood will get there. And then the person's sitting there going, but my shoulder's killing me. Please work on my shoulder. And somebody who's only principle based won't even work on your shoulder. Well, that just upsets people. So, no, we want to work on the shoulder, but we also want to understand the principle. So, we'll get into that a bit later. So, but where I'm going to take you now is leading up to where I led when I graduated in 1997. So, what did we have when I graduated in 97? We had the opening of craniosacral. That's going to be William Sutherland. So, back in the late 1800s to early 1950s, he discovered cerebral spinal fluid was the breath of life. He upgraded the rule. Oh, I've got artery written down there. That's to say artery. I'm just going to write this down so I can correct some of these mistakes. He upgraded it. And so that's Sutherland Cranial. Then from there, there's a company called Upledger.
You want me to bed?
We've got somebody in here. Let's just kind of see what's happening. So I've got some sound in here, but I'm not sure what's happening. Oh, good. Okay, so what we've got Sutherland creates craniosacral. Then Upledger creates their own version. So there's a difference between Sutherland or Sutherland cranial and Upledger cranial. We can talk about that later, but there is a difference between the two. Then we're going to fast forward a little bit and we're going to go into Ida Rolf. Ida Rolf, I would say, would have been my idol when I graduated because she was the fascia. Rolfing is what it was called. And that's where you got that deep tissue, push that fascia. And she had a PhD in biochemistry. And she was going, well, structure and function are related, but she believed working with the fascia was going to give a better result to posture and improve function. This is not something Andrew Still was doing. She expanded it. Then we're going to fast forward even further for us massage therapists that graduated back in the 90s. It was all about Travell, trigger point. When I was in school, I had to memorize every single trigger point in their referrals. Holy cow, that was exhausting. But they discovered that there was tender spots. They've also discovered a lot more about trigger points since I graduated in 1997. However, the curriculum has not really caught up and doesn't even teach it. So then of we go into root causes of what's going on. Now, oh, sorry, I had a slide here. My apologies. So we go into osteopathy is based on the principles, but we got a little bit more. Fred Mitchell came in and he started
Okay.
doing what's called muscle energy. So he used muscles to contract to stimulate the natural release of the joints. So we call this muscle energy. You can call it contract relax. There's so many different ways to manipulate his philosophy. Okay, there isn't just one way. So anybody who says it has to be done this way, you're missing the point. What he's saying is if you contract a muscle and contract it, you got a whole plethora of stuff that's happening. That gives you a whole plethora of information. It's almost like going into, putting something into, your chat GPT and it comes out with all this stuff. And you're like, holy cow. All right, well, I'm going to use this and this. That's okay. So when you learn muscle energy, you've got to learn it from the perspective of what is it telling me and how can I use it? Brilliant work, but on its own as just a structure, it doesn't really get the results that you want it to get. Then Pierre Barral, who is still alive and teaching, is our father of visceral manipulation, which is basically manipulating the organs. I remember the first time I heard about it, it would have been in 96 because I was in school. And one of my teachers is saying, oh, you got to take this visceral manipulation stuff. So she ran a little workshop in visceral manipulation and taught it. So the school I was at was actually teaching a lot of osteopathy stuff, but the owner of the school was an osteopath. So I got a lot of exposure to it early. And now Baral I don't know if you could take all of their courses in one lifetime. They have so much. You've really got to figure out what kind of a therapist you're going to be because you could spend $100,000 and all of your time just with how brilliant this man is. He's actually so brilliant that he he's a doctor and a therapist. And after his patients died, he would go in a cadaver and take a look at what was actually going on. He has got he has got such a brilliant mind. And so that's where you're really going to master your your visceral work. We'll talk about that a little later as well. Then you get into a little bit more modern science, as we'll call it. So if you go back to Dr. Stephen Levin, he termed the coin tensegrity. And then that further got coined into what's called biotensegrity. So sorry, Buckminster Fuller, he coined tensegrity, and then Stephen Levin came in and said biotensegrity. So basically, he said everything is connected. So he's saying, hey, like this is connected to this is connected to this, and we'll talk about biotensegrity in the program because it's something you have to understand. So deep breath. History is insane, and most students come in and go, all right, that's a lot of information. Don't worry about it. Here's what I want you to get from that is where does this leave us today? It leaves us where in the last 50 years and in the last 10 years, there has been an explosion of new information that we really don't know what to do with yet. So, to most of the people in therapy, it would be like if they brought somebody from 1960 into today's world and go, oh, let me tell you what's happened. We've got phones and we've got this and we've got Zoom and we've got this. That person's brain would probably want to just, honestly, what you'd probably see a cartoon character explode. Too much. That's what's happening today. Is the massage therapy curriculum is a 2,400-hour program. And they don't teach any of the new science over the last probably 10 to 25 years and everything that's come up. You got osteopathic programs and they go, oh, well, we just stick with Andrew Still. Well, that means you're going to spend a lot of money on postgraduate stuff if you're only sticking with his work and a few of the basic techniques. So we need to catch up to modern times and say, what do we do with this? Okay. I hope this is making sense. If not, hopefully you're bearing with me here a little bit. But where I want this to go is where are we at today with the different type of therapists that we have? Here's where we're at. Treating the root cause. Everybody wants to get to what's the root cause? All right, I don't want you coming back into my office again and again and again. Let's get to the root cause. So we go into belief systems. Chiropractors believe the root cause comes from spinal segments. Acupuncturists believe it comes from chi energy. Physiotherapists believe in exercise and rehabilitation. Massage therapists are manipulating soft tissue. Osteopaths say blood has to flow. So now you've got four different belief systems here. What do you do with it? No wonder why I was so confused. No wonder why I was sitting here going, I've taken all this stuff and I don't know what to do. Well, that would be like going out and learning four different religions and saying, who am I praying to? Like, yeah, that's a little bit mind-boggling. So what does that mean? That means that every school teaches differently. Every therapist has to create their own style. And this makes the world of osteopathy confusing, very confusing. Then you get techniques versus principles, like we talked about earlier with Jenna. Okay, so now you want to hit pause on this and take a break. Now would be the time because we've covered a lot, but I'm really getting to my point here and I'm going to try and get there as quickly as I can. So for me, I graduated massage and then I took cranial sacral, myofascial, visceral manipulation, joint play, strain counter strain, muscle energy. Already had soft tissue, Jones technique, soft tissues in there again. You got all your techniques. What do you do with these techniques? Well, you guess, usually, is what ends up happening. So, principle based is if everything comes from blood flow, fix the viscera. The spine must be in line in order to heal. So, start at the spine. Well, I only do cranial sacral therapy, or I only believe in XYZ. So this is kind of what's happening out there is it's so confusing and people are just they're confused in their own treatments and they're only confusing the public. So poor the public is just going from therapist to therapist to therapist because they're not getting better. And there's a very big reason for that. We're going to get to that. All right. Now, when I teach my students, I say you got to look at your techniques like it's a medication. Medication's a treatment. When you go to the doctor and you blur it out, he comes out with an assessment, he comes out with a diagnosis and says, oh, how are we going to treat this today? He might treat it with painkillers. He might treat it with other medications. He might treat it with surgery. He might send you to a massage therapist or a physiotherapist or an osteopath. It's a treatment. All right. But how did he decide what the treatment is? He just took his knowledge and said, what is the best path forward? You cannot provide a treatment if you don't get the assessment right. That's the key. It's assessments. That's what they're not teaching you. So could you imagine going into the doctor and going, well, that medication's not working. Let's try this one. Okay. Now, luckily for us, techniques aren't likely going to cause a massive amounts of side effects unless you're doing something that's, really, really, really offside. So the true osteopath does two things. They're amazing at assessment and they're amazing at listening. And we're going to talk about listening a little bit later. But the key is I need to assess my client. I need to offer a treatment. That treatment could be cranial, visceral, joint mobilizations. It could be some of these contract relax techniques. It could be lymph drainage. It could be soft tissue. But then what you need to do is you need to go back and reassess. Did it work? Because if it didn't work, it's likely not going to work. Now, you could say, well, just give the body some time. Mm-mm. The body will always show you if it did anything. Now, maybe it did something that has nothing to do with the reason why the person's in there today. Maybe they go home and have this huge emotional breakdown and go, oh, see, it did something. Okay, but are you going to build a great reputation because you're randomly getting results and you don't even know what's going on? No. You've got to be able to assess, provide a treatment, go back and reassess. Is it working? Am I getting what I want? But do you even know what you want? And this is what we train you to do. This is what they don't train you in a lot of the other schools is they don't train you how to think, how to process, and how to go through that system. They just teach you all these techniques and say, go figure it out. I think that's what Jenna was talking about earlier as well, is as how do you incorporate both of it? How do you integrate it? That's one of the hardest things to do. Okay. So in saying all of that, where does that leave you? Well, you got to decide who do you want to be? You might say, I only want to do XYZ. What you don't want is saying, my way is better than somebody else's. And it's not about, I'm not sure why I put that in there. You know what? I'm going to skip that. We're going to pause because, again, I'm going to come back to that. Um, in fact, there's a whole bunch of stuff here that I don't even
Guys,
cover. So,
ah,
oh, what's wrong? Who do we got here?
Wally, Kristoff, why are you guys barking? You guys don't do this.
We got Wally and Christoph barking in the background because somebody sound on, but I'm not sure where my thing is to let me know my other participant here, but that's okay. Um, all righty. So what I'm going to cover next is, all right, here's where I want to go next is where most of us here are massage therapists. Some of us might not be, but that's okay. If you're a massage therapist and you're thinking, where is it that I want to go to? What I'd like to do is I'm going to compare the different therapies out there. So we're going to start with the chiropractor. The chiropractor spends 8 years in school. So he could jump out and pretty much make 150 grand a year fairly quickly, depending on how quickly his practice builds. Why? Because of a master's at diagnostics. They're paid to use their brains, quite frankly. They do spinal manipulations are very dangerous. So you're going to spend money for somebody to make sure that it's safe. And they're the experts at spinal disease and oftentimes going to injuries if they specialize in it. So they're making really great money. And I see a lot of massage therapists going, well, I want to be able to work like that. I want to be able to make $100,000 a year and I want to be able to do 20 to 30-minute treatments and go, well, but they've spent 8 years in school. So they're pretty strong in their belief systems. The public trusts them and you haven't done that. So we need to be able to fill that gap. You got a physiotherapist, spent 6 years in school. They make 100,000 pretty easily and fast. They're the masters at movement. You have a surgery and they're the ones who are they're gonna fix you up. And they're paid to do orthopedic assessments. That's great. Thanks for the knowledge, but can you work on it? Acute injuries, yes. Chronic pain, not so much. So then most massage therapists end up with chronic pain. They spend 2 years in school. They can make 50,000 pretty quickly. They're the masters of stress. They're paid to use their bodies. So they could be considered the chronic stress experts in relation to muscles. Now let's go to the manual therapist. The manual therapist spends about 4 years in school and they can get up to 100,000 pretty quickly. They're the masters at getting it to the root cause. They're paid to use their techniques. It's kind of like energy meets blood flow for self-healing. But how do you position yourself in as an osteopath to be able to go out and say, I can confidently stand behind what I do and this is what I charge and then get the public to buy in. We're not really there. So there is a little bit of a gap kind of happening. All right. So, but at the very least, a massage therapist upgrading to an osteopath is might not double your income, but you're going to be able to charge more because you're going to be able to do more. And I think this is where a lot of therapists land is some massage therapists are like, hey, I want to go to osteopathic school because I'm bored, because I'm exhausted. I want to learn some new techniques. I want a different approach. I don't want to spend the last 15, 20 minutes of my session just staring at the clock, wasting time. An osteopath does not waste time. We go in, we figure out what's going on, we do our correction, we give our clients either their home care, we give them their instructions. Things are very bah. And however, your traditional training in a lot of the other schools, they don't teach you how to actually work like that. So now you're a massage therapist with a bunch of techniques. You're not an osteopath. And I don't know if this is going to make sense yet, but I'm hoping that I can get this across. And if not, I can answer some more questions later. So I'm going to say that the massage therapist with osteopathic doesn't work. You've got to be an osteopath that does soft tissue. Because then what happens is you're a massage therapist with osteopathic is just somebody who's taken a bunch of classes and there's still going to be a missing piece. So the massage therapist has to learn to say, okay, I'm an osteopath who does soft tissue. So you're going to call yourself an osteopath. Now you can say, hey, I'm a massage therapist and an osteopath. This is my approach. That's fine. How you word it is up to you, but you need to be able to understand and believe it and know what to do. That integration is going to be the hardest part of school. So this would be the time I would ask a lot of questions. Do I have any questions? Jenna, is there anything you want to say? Because I feel like I'm just rambling.
Well, I mean, I mean, it's a little bit different for me because I'm not coming from the massage background.
Mm-hmm.
But I would say, I think if my primary profession was massage therapy, I I would have a difficult time implementing a more structural approach of osteopathy. If you've got, I mean, just to be completely blunt, like a person naked under your table with your sheets. I don't work that way. So I would imagine as a massage therapist trying to learn and integrate, it would be difficult because you've got somebody who's coming in for massage, but now you want to practice different techniques. Well, that's great if you're in your cranial portion of your program or the visceral, but then you've got joint mobilization and movement assessment and osteoarticular balancing. And I can't imagine how you could integrate that in a massage thing. So I think that's why you're putting this program together specifically for massage therapists, because that to me would be such a barrier of learning and trying to figure out how to put that together. So I think in my area, a lot of the osteopathic therapists came from the massage background, and they do tend to lean more into principles-based or cranial osteopathy because it's easier to integrate as massage therapist. So I think the challenge would be if a massage therapist going into the program who's inherently a bit more structural in their approach, how do you make that transition? And I think when you said you have to start thinking about yourself as an osteopathic therapist who does massage therapy techniques, that's how you would make that shift in your head. And you would have to set that up as a separate session that people would book in the Jane app. You know what I mean? Like
Yeah. Mm-hmm.
mindset and then how you integrate it are still different. And as you're going through school, you learn another technique and then you're like, well, I don't, how do I integrate that? Because you have to practice it in order to integrate it, but you're not often told, well, how do you integrate it? It's someone's coming in for neck pain and you've just learned, as a massage therapist, you already know the myofascial and the trigger points. But then what if you've learned muscle energy techniques on top of osteoarticular balancing? And then how do you layer that into your massage? Like that's like it's really tricky. And I don't think a lot of schools teach people how to integrate it in a very practical sense in the moment. because that's the only way you can really learn is if you learn something and then learn how to integrate it right in the moment so that when you're going back out and working with your people, you're like, ah, this is how I integrate this. Great. And then you create that layering process. I hope that makes sense. I
I
don't
am
know.
so happy that you said that because I'm now going through my slides going, oh my God, there's so much now I don't even have to really get into because you nailed it. And that was the biggest thing that I saw in when I was teaching at the osteo schools is what they do is they bring in a specialist for cranial and a specialist for visceral and a specialist for myofascial and a specialist for muscle energy. But then those four practitioners are not on the same page. They don't believe in the same thing. And then they all have their own assessments. So then you spend literally a day in school going through slightly tweaking the assessment, and then you learn some techniques. And you're just like, I don't even know what's going on. I can't even feel anything. And they don't even teach listening skills. They just say, oh, you'll figure that out afterwards. That's the core. That's like going to massage school,
Yeah.
going, oh, you'll touch people afterwards. No, I need to
Yeah.
touch them now. Right.
Well, yeah, and
And
if you're a tactile learner, like I'm a very tactile learner, I have to be able to implement what I've learned pretty immediate after when I've learned it. And like we both went to NAO, and NAO, if anybody who's listening to this probably knows, is more of a techniques-based program as opposed to principles-based program, based more a little bit more on the European or like the British model, which we could discuss later as well. But they just sort of fire hose you with like I'll take lumbar, for example. Here's all your lumbar mets and your lumbar mobs and all the things, and they just fire hose it to you, and you have like 10 or 15 different ways of doing it, but then they don't really teach you how do you boil that down into two techniques that you really like to do. You're kind of left to do that on your own. And so that, the constant fumbling around, I think, is really unnecessary. I think, you could teach all of that, but then also teach the piece of, okay, if you're a massage therapist and you've got somebody on the table, obviously prone mets and mobs are going to be the easiest things to implement, right? So you wouldn't necessarily implement for that particular therapist a lot of the sideline techniques because now your patients are getting wrapped up in their in
they're
the
getting wrapped
sheet,
up in their sheets.
right?
Yeah. And
So
there's no
yeah,
massage therapist out there. Oh, sorry to interrupt. There's no massage therapist out there who goes, how do I get my person coming in for massage on the table with their clothes on? How do I fill that gap? That's huge. And that's something that they do not, and there is not a single program out there in osteopathy that's going to teach you how to do that. And then you're in a room by yourself. You're not even, at least with a physiotherapy group, they can be like, hey, why don't you try this? Or hey, try this. No, you're by yourself. So now you got to hire a mentor. That's where I landed. So then I started mentoring all these massage therapists to be like, how do we integrate this? And how do we feel this? And what do we do? And then what happens is they end up going back to massage anyways. And they're like, I spent all this time on these courses. I'm not really using any of the techniques. And I'm right back to where I landed. I'm doing deep tissue massage all day long and I'm exhausted and I'm not making any more money because I'm no different than everybody else. So it's a big problem. And that's the gap that I'm trying to fill for the massage therapist. That's why I decided that I was only going to run this program for massage therapists because it needed such a big focus. Could I train any therapist? I absolutely could. It's just that for the time being, that's where I wanted to put my focus.
yeah,
So, yeah, go on.
and that makes perfect sense because you know, I didn't come from a massage therapy background. I came from exercise rehabilitation. I mean, we did our kinesiology program together way
Hmm.
back. Um, I came from exercise rehab, sports performance, Bowen therapy, which is again clothes on. You don't have to tumble people around in their sheets and worry about all the stuff. Um, but I still had to teach myself my own integration and process.
Hmm.
And and so it's like depending, it just doesn't really matter what school you go to, there's that integration piece that's missing. Let's say, for example, at the end of your 4 days,
Hmm.
because we've all been there. We've all been to a course. You take it for 2 days, 3 days, 4 days. You learn all of this, and you have the theory, and you have the practice on everybody. The whole we've all been there. Um, and then you're like, okay, bye. And then you go back to your office on Monday morning, and it's like, great. I learned that technique. It was really amazing. I think I can do it on Monday, but without having that sort of in-person integration piece that allows you to sort of just almost like muscle memory and build it into what you would normally do. So you could have like all the massage therapists, like how do you how do you create your assessment? Okay, now before you leave this class, I want you to integrate what we just learned into what you normally do so that it fills that gap and they don't leave feeling like, well, that was great, but now what? And then it's like 6 months later before they like pick it back up again and integrate it. I see that a lot with different therapists.
You nailed it. Thank you. You just made my job so much easier. I love it. Thank you so much. Yeah. So, and this is why I decided to do this webinar, is because so many massage therapists are saying, I want to become an osteopath. I want something different. And like, whoa, before you go into a program and spend another fortune and a lot of time and are given a lot of extra work that you don't need, let's just really educate you a little bit here. Let's get you to understand what osteopathy is, the history of it, where you're at, and let's go over a few really key points that nobody is talking about. And the number one thing that no one's talking about is, what are you going to do with it? They don't care. They want to take your 16 grand and teach you cranial, visceral, joint manipulations, and then muscle energy and send you on your way. Well, most massage therapists have already taken some cranial courses. They might have taken visceral. They've taken extra myofascial. Maybe they took rapid. Maybe they took like all these other things. And then say, well, how do I integrate that into my treatments? So it's almost like the massage therapists are taking all these extra courses. They're actually in school for osteopathy. They just don't know it. And they never get the designation. So they're never getting paid the extra money. So money, you know what? Hey guys, we got to pay the rent. The economy is like, we need that extra money. So we need to know, how are we going to make some extra money? That's really important. Two, I don't want to be bored. Three, I don't want to be burnt out. Four, I'd like to get better results. Honestly, ask yourself, is that your order of importance? Are you more important fixing, is it more important to you to fix somebody else than it is to make more money? Let's be real, be honest. Probably not. It's probably like, no, I need to pay the bills, right? If somebody was putting 100 grand into your account every month and said, all right, you need to contribute to society, what would you do? Well, that almost like shakes the brain up a little bit, because the brain can't even comprehend A, that happening, and B, what would I do? That opens up a whole other thing. Most of us, we get up and go because we have to. And we don't hate what we're doing. We enjoy it. Well, I'd like to take you past that a little bit and love what you're doing. So now what we got to do is we really need to spend some time on, who do you want to be as a therapist? What kind of therapist do you want to be? What kind of treatments do you want to be? A, it's hard to figure out. B, even harder to implement it. So what do? You take a bunch of coaching programs, you take stuff into like, let's change my mindset, let's get over some mental blocks. Got to get through all of that. Well, holy cow, how much are you going to spend on that? Like you kind of end up in a bit of a hole that you can't get out of. And it's a hole that chiropractors don't get into because they're making enough money. They don't care. Quite frankly, they really don't, because they're making their money and they're helping people. Then you get physiotherapists, and physiotherapist, it's very rare that a physiotherapist says, I don't think I'm really helping people enough. I want to take more courses. They don't actually do it. And then you've got the massage therapist. And the massage therapist will say, oh, well, I want more techniques. I want to do this. I want to do that. But in reality, they want to make more money and they don't want to hurt their bodies and they're exhausted. So we got to be real about that. And there's no schools that are teaching it. And so what happened is I was doing all the mentoring. And then I had some of my mentees in massage. because I was teaching them, hey, let's get you making some more money. And then I just said, like, hey, I think you need to become an osteopath. But then they were like, okay, but it's 16 grand. And they make me do this, they make me do this. And the amount of homework they give you, like, just not necessary. And so I said, okay. And I started looking into it and said, you know what? I'll start a program. Found an association for billing, which I'll get into the associations later and how that works. And let's open up this program. So, what I decided to do in this program is I decided to tackle it a little bit differently, which I'm going to get into. So, before I get into that, I do want everyone watching this to understand what the different schools are doing because hey, maybe you're like Denise, I just don't think this is the school for me. Not a problem. But I would like to answer the questions because I did have a lot of people asking me about different schools and what's happening. So we are going to jump into that next. So what we've got here is osteopathy is type 1 and type 2. What does that mean? It means that type 1 is generally a 4-year program, but it's usually somewhere between 3 and 5, actually, depending on the school. Type 1 programs in Canada. Here's another thing is osteopathy is different in Canada than it is in the United States and than it is in Europe. They are three different beasts, completely different beasts. Massage therapy, pretty standard around the world. Chiropractic, pretty standard around the world. Acupuncture, pretty standard around the world. Physiotherapist, pretty standard around the world. Osteopathy, not even close. They are so different, they're not even recognizable amongst each other. That's the thing to understand is you're going to have a hard time explaining what osteopathy is when the difference between the different countries is that different. Okay. So, but in Canada, let's just talk about Canada because we're in Canada and this program is in Canada. You have a type 1 and a type 2. Type 1 is no previous education. So they run you through a 4-year program. Sounds great. Hey, is that like physiotherapy? No, because if we go back to when I graduated in 1997, the way it was designed was massage therapists had to do upgrading education in Ontario. So we would take courses from osteopaths. And what they did is they said, well, hey, here's what we're going to do. You can sign up and you can take some of these courses, slowly implement them into your massage practice. But we'll do it over 4 years. You'll come in one weekend a month for 6 months a year. And then in 4 years, you'll get a diploma of manual practice. Great. So that was a wonderful setup for the massage therapist. They didn't change it. Then what happened is the program that Jenna was saying we went to, they said, well, why can't we accelerate that and get these people trained in a year? So let's bring in therapists that have massage therapy, that have another background, and we're going to train them in a year. And then they created what's called type 2, meaning you've got previous education, it's a 1-year program. And that's usually around 4 days per month over 10 months, plus clinical hours. So you got your previous education, which is 2,200 hours, plus another 1,000 hours. You got a 5,200 hours into school. So now you got the hours that's more comparable to, say, a physiotherapist. You got enough hours that's comparable to those other designations. So remember, your chiropractor is going to have something like 6,000 hours of education. Your physio is going to have something like around 4,000 hours. Massage therapists only have 2,000. So what we're going to do is we're going to fill a gap. And we're going to add in an extra 1,000 hours so that you are now up a little bit more. You get paid more for that. Now, if you wanted to go back to school to be a chiropractor, you make a ton more money, but it's going to be a lot of years. So that's the gap that we're filling. But you need to understand the landscape of the school, which is type 1, type 2. Why would a massage therapist go do a type 1 education for 4 years? Just why would you do that? There's only one reason why you would do that: insurance billing. And we're going to talk about that. So the type 2 programs became available to just upgrade the massage therapist. Now, since then, a lot has changed. And that's going to have to do with that osteopathy, sorry, the insurance billing world, or we'll call it the political landscape of osteopaths. There is no regulation for a manual osteopath. There is none. So that it means it's a little bit like the wild, wild west. So that's what's still happening in the osteopathy world. It's the wild, wild west. So if you were to say, what is osteopathy? You could probably say, well, it's the wild, wild west still of manual medicine, which is kind of like being a naturopath, except instead of giving supplements and diet, We are doing manual movements with the body. It's kind of what it is. But it's kind of crazy all around the world because there's all kinds of different types of approaches. There's all kinds of different types of ways of doing it, and different people are doing different things. So you're not going to get a straight answer. But one thing stays the same. Osteopaths get results. They just do, which means people are going to different osteopaths to try it out because they're getting results. And people are willing to pay more for results. That is the one similarity between it all, because the osteopathic view is get to the root cause. And they're willing to take into account the nervous system. They're willing to take into account the blood flow. They're willing to take into account the injuries. Now, some of them are just principle based. You might get results, but maybe you don't have as much control over those results. So, in saying that, let's take a look at some of the different schools here in Canada. So, you've got the what's called MOCC, Manual Osteopathic Colleges of Canada. They've got some across Canada. It's a 1 year program. That program is going to run you about $16,000, and you're going to have a ton of homework and assignments, and it's going to be confusing, but you're going to get your designation. Then you've got NAO, National Academy of Osteopathy. As Jenna was saying before, it's very techniques based. You're going to get a whole pile of really cool techniques, but you're not going to be taught how to implement it. Then you're going to have a school called CAO, which I do believe the one in Hamilton is now closed. That was a 4 year program, and that's more for if you do not have a background. Then you've got a school up in Alberta called NMOC, National Manual Osteopathic College. The instructors from here actually are have opened up MOCC because these guys really didn't like what these guys are doing. Sheridan College does offer really good, and it's a degree. It's a good program. It's a degree. It's 3 years. So if you want to go to Ontario, now that's going to be full time. This isn't going to be one weekend a month. This is definitely going to be the program for the non-massage therapist. And at least you get a Bachelor of Science in Osteopathy. Kind of a cool program out there. But again, that's a lot more education. And how much more money are you going to be making? Then there's a school called Sarah Canadian Osteopathic School. It's 3 years. There's one called Ontario Progressive. It's actually 4 to 5 years. So there's all kinds of different schools out there that are doing different things, which is why everything is just a little bit confusing. Why does this matter? Why do you need to know this? It comes down to associations. Because it's not regulated, there are, I'm not going to say hundreds, but there is a lot of different associations you can join, and different associations will be able to bill with different insurance companies. So one association might not be able to bill Manulife. One association might not be able to do Sun Life. One might not be able to do this. So it's a little bit all over the place. So, and this is pretty much across Canada. So what happens is when somebody becomes an osteopath, you better be really good at trying to draw on the clients that are like, look, I pay for you regardless of whether or not I have insurance. And you're only going to be able to do that if you get results. Because most people only have about $500 a year on coverage. They'll be like, fine, I'll use my coverage over here and I'll come see you for this. People are willing to pay if they're going to get those results. So we're not really worried about it too much, other than we might lose some clients because, hey, my insurance isn't covering it. Now, the great thing with massage therapy is that we can also bill under massage. So I'll get to that in a second. So for the osteopaths that are not massage therapists, it's really important that you stand in how I'm doing things. Here's my philosophy. Here's how I work. Here's what I work on. And I'm only going to work on you if you're going to get great results because I know you're going to pay me for it, regardless of whether or not you got any insurance money coming in. So you need to stand behind what you're doing. And unfortunately, that means you're going to have to work harder. You're going to have to be better, and not just a little bit better than everybody, a lot better than everybody. So you better stick to what you love and what you're good at. And how do you do that? Well, how you do that is you tap into your intuition. You tap into your essence. You tap into who you are. You tap into, we'll call it maybe some psychic abilities, if you will, but you tap into your listening skills. The body will tell you. And we're going to teach you that in this program. That's one of the things that makes us stand apart. So, why might you choose this program maybe above other programs? Or why wouldn't you? Well, because we need to teach you how to upgrade your massage. Now, the great thing is, you as massage therapist, is you can bill under either or because every technique you learn in osteo is under the scope of practice as a massage therapist. So there's there's you can bill under either or. But you just have to know when the client comes in, what are you booking in for? And I need to make my notes accordingly. So we'll teach you about the soap notes and how you change that and how you work with that. We'll cover that in the program. The way we've designed the program is very different. We respect you as a massage therapist. And so we're designing this for the busy therapist so that it can fit your schedule, your budget, but we are not going to sacrifice any quality. We've got some exclusive training that's happening. So there's a technique that I've termed called tissue melting, and it is a very intuitive listening skill. And I'm going to teach you how to listen to the tissues. Now, here's the great thing about tissue melting is it's not like learning techniques out there. It's not like learning rapid. It's not like learning cranial or visceral. It's none of that. What it is, it actually teaches you how to make the decisions, how to hear the body. So what I do is I say, okay, I'm going to teach you how to do this thing called tissue melting. Then we're going to take all of those techniques that you learned. We're going to take all the ones you learned in this program and all the ones you've learned in other programs, and we're going to put them on a bookshelf. This can be your toolbox. And I'm going to teach you how to assess. I'm going to teach you how to figure out what's going on with that client, grab a tool, apply the tool, reassess it, put the tool back. Did it do what I wanted to do? Do I need to grab another tool? Maybe I'll take this approach. Maybe I'll take that approach. So there's some key things that need to happen for you to do that. You need to be really good at assessment, really good at interviewing, really good at reading your patients, and get your results. So that's what we teach you because that's what I did. That's how I built up my practice. And it's not that difficult to teach. I thought it was going to be really hard actually. But once I sorted it out, I was like, this is actually not that difficult. And when I was teaching in the massage school, I actually started teaching my massage students how to do it. If I taught them listening skills before they really learned anything other than your petrissage and your effleurage, if I taught them how to listen, bang, 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 they just like flew. And the students that I didn't teach, that maybe I caught them in some of the other classes later in second year, they had a bit of a harder time catching up on it. But then once they caught up on it, they were like, wow, this is life changing. And it's just being just knowing how to listen to the tissues, and it's very intuitive. So to circle it back, remember what did we say about Andrew Still? He called himself a magnetic healer. Jesus would have called himself a magnetic healer. Hippocrates says the body can heal itself. There's a theme that's happening here. Why would we not do what's being done for thousands of years? Which is you've got to use your intuition. You've got to use your listening skills. You have to be able to tap in and say, huh, the body seems to want me to do this. How am I going to do that? Huh. Well, I could use this technique, or I could use this technique, or I could use that technique. Bang. And then you might find one person in the class says, yeah, I use this technique and bang, I get the result. And another one comes in and says, but I use this one. Great. You're going to use what works for you. So I started training therapists probably about 20 years ago in the clinic, in this big clinic that I was running. And I'd have an osteopath in there. I had a chiropractor in there. I had a acupuncturist in there and a massage therapist. I had all kinds of different, and I said different modalities, different therapists. And what I did is I said, we're going to have some fun. We're all going to do our own assessment. We're going to collaborate. And everybody went, yep, general consensus, the sacrum isn't moving. General consensus, this muscle, the psoas is just like this. Okay, we all, do you concur? Do you concur? Do you concur? That's what we did. Then say, okay, who wants to tackle this? And you try it. Did it work? Maybe it did. Maybe it didn't. Okay, try this. Try this. And we did this several times over and over again. And what we noticed is the technique really didn't matter. It was the connection between the therapist and the patient. It was knowing I need to release that psoas. I need to get that liver moving because the fascia's stuck. I need to do this. And how you do it is less important than the intent behind it. Having the intent to say, okay, I want to free that up because this liver is swollen. I need to be able to free this up. How am I going to do that? Your intent is 90% of it. The technique is just the delivery of it. So, like, think about it from the perspective of a message. I need to tell somebody on the other side of the world that I got a message. Hey, your brother's coming to town. That's my message. I can write a letter. I can send an email. I can make a phone call. I can pass the message along. That doesn't matter. Did I get the message across? Did you get the result you wanted to get? Well, most of us don't even know what result we want to get in massage because they don't teach us that in massage school. That's what we're going to teach you. That's the integration part. That's the beauty of it. That's the approach we're taking. The other thing we're going to add in there is there's going to be some business integration. So we're going to teach you how do you integrate this and how do you this is what my business is set up. What do I do? We're going to mentor you through that. We're going to have some classes in the program that are going to help you sort that out. And where are your roadblocks? Be like, hey, you know what? This is my situation. How do I do this? We're going to be covering that because we get no business training in any of these programs, chiro, massage, physio. There's no business training. So we're going to put a little bit of business training in the program. Okay. So here's what we've come up with is we've put a program together that is designed for you as the massage therapist. Why? Because of the integration part of it. Now, again, do the other therapists have a hard time with integration? They absolutely do. However, there's only me. I'm still building out the school and I'm still building out my instructors. I might add those in later, but for the time being, we're going to stick with massage therapists because we need to teach you how to get your patient to buy into this new way of treating. Means I need to teach you how to get into there. So I need to spend quite a bit of time on that. Whereas the other therapist, they can jump in and all I got to teach them is integration. I don't have to teach them to transition from a naked person between two sheets to being able to do this. So I'm going to nail that first, and then I can bring some other practitioners in. But if you do have a background such as kinesiology, or you're a nurse, or you have like a healthcare background, you could actually take this program as well. So what we're going to do though is we're going to do it a little bit differently. A, we don't want to waste your time. We don't want to make you do things that are not going to drive you forward. We're not going to give you work for the sake of giving you work. We're not going to give you case studies for the sake of giving case studies. You have probably treating 20 people, 25, maybe even 30 patients a week. You got them all there. You don't need to do work that is not going to help you. Now, for the nurses and the kinesiologists, they don't have a patient load. So they need a bit of a different beast in order to get that practice in, which is another reason why I'm just sticking with massage therapists for the time being. So I can give all that focus onto those massage therapists. And so what we're going to do is we're going to record, there's going to be a lot of lessons recorded online that you can go through in your own time and space. So we're going to redo, we're going to slowly go through that little bit of history. Do you have any questions on it? Do you understand it? What's your perspective on it? How do you see it? How can you explain this? We're going to go through and understand the principles on their own. Then we're going to show you how to do some of these techniques. But when we bring you into class, it's going to be all hands on deck. Once you come into class, it's going to be, you got to master it. Let's go. Okay, hold on. Let's go. Let's go. Let's go. We're not going to spend a lot of lecture time in class because I don't want to waste your time. You're going to use your existing clients as your clinic. And I've made it very simple as to how you fill that out. It's going to be really, really, really simple so that you get to use those hours. So if you're already seeing, say, 20 people, well, you're looking at a minimum of 90 minutes by the time you do the assessment and everything else. So we'll call it, we could even double it, really, if you wanted to put a little bit of time into thinking about it, putting some notes in. So let's say that's 2 hours. So that's 40 hours a week right there. That goes towards your clinical hours. So this is how you're going to get all your clinical hours in by the end of the year. You're going to use your existing clients. And all we're going to do is we're going to slowly transition you. So you slowly come out of what you're doing and come into here. The other thing that I found that the students in the other school were really struggling with is they would teach them this one technique but then they weren't sure how to use it when they go back. We're not going to teach it to you that way. We are actually going to say, okay, this is what I want you to do. It's going to be very specific. I want you to practice that on your next client. Then I want you to practice this. And then I want you to practice this. And then I want you to practice this. And in your soap note, all you're going to do is you're just going to go in and it's going to look like a little Excel sheet that's going to go in and go practiced cranial, practiced this, practice this. That's it. That's all you got to write down. However, at the end of the program, you are going to have to write up a couple of reports that are needed for you to match the type 1 standards of the WHO program. And one is going to be a case study, but we're going to do the case study a little differently. We're going to make it very practical. We're going to blend it into our business studies. So then that way you're able to use it to propel you forward. We're going to also use it for you to be able to say, hey, I went from being this kind of a therapist to this kind of a therapist. So there's going to be a bit of coaching in there for you. And then you're going to say, hey, when I first started working, this is what I was doing. This is what I see now. And then you get to pick one of your patients that, oh my gosh, this is what happened. This is how I was treating this patient. And within a year, this is how it changed. So, case study on somebody. And you don't have to decide right away who that is. You get to go back on your notes and say, you know what? My biggest transformation was Susie, because Susie, I was never able to get any further with her. And now this is what's happening. That's going to be your case study. And the last thing you're going to do is you have to do a dissertation. So, you get to choose a topic. Now, guess what? There's no rush on that. So the dissertation is needed to get your MOP, Manual Osteopathic Practitioner. You may not need that right away. You might say, you know what, it took me 2 years to get through this program. That's fine. You might want it right away and you get through it in a year. We are going to work with you. We are not going to rush you, but we're going to make it structured so that you don't give up. And that's how this program is going to be put together. Now, there's something else that we've decided to add to the program, which is if you have craniosacral already, you do not have to take it again. If you've taken visceral manipulation, you do not need to take it again. If you've taken muscle energy techniques, you don't have to take them again. You'll take the tissue melting because I'm the only one who teaches it. So you are not going to have to waste a bunch of time. You get credit for what you've already done. Now, doesn't mean you don't have, you can take it if you want to. You absolutely can. But if you've taken a program, I'll take a look at it. And as a general rule, all of Upledger's are included, all of Baral's are included. As long as I can see that you understand it and you're using it, you're going to pass the final exam. And we'll still coach you until you pass it. If you don't know it, then you can take one of our classes. But you've got two streams, which is Upledger and Baral. They're the top dogs. So once you graduate from osteopathy, depending on what you decide to do, whether you work under your massage umbrella or under your osteopathy umbrella, you may still have to take continuing education credits. Those credits are best done with Upledger and with Baral. They have more than enough courses for the rest of your life. Now, not that you wouldn't take other things, you very well may, but they are the masters. They are the European masters at it. So what happens is that most people are going to take a $16,000 program and then have to go get CEUs. So they got to redo them. So then they got to pay for them all over again. And massage therapists, you've already taken it. Why would you take it again? And even as the osteopaths coming in that are nurses and that are physios, when I was in the not physios, sorry, the nurses and the kinesiologists, I'd say to them, don't worry about it if you don't get it right now because you're going to have to do CEUs and you're going to redo it over here. They're like, why would I have to redo it? Why am I not learning this? I'm paying $16,000 and flying in every month. Like, why would I have to redo it? And I'm like, that's just the way it is. So I would rather you get started right away on those paths and let's figure out what paths are best for you. Do you have to do all these techniques? No, but we're going to teach you. Okay, you have to at least recognize it and maybe you find a different way of doing it. We're going to make it unique to you so that you have a thriving practice where you are making more money, where you are not burning out your body, where you're having fun with what you do, and you're not wasting time. The challenge is going to be changing your identity from being a massage therapist to an osteopath. And how do you position yourself? but we're going to work through that. And that's how we're going to do this program. So let me just go over the cost of what are we looking at. So this is what I have put together for you. If you were to take your manual osteopathic practitioner, it's around 15 or $16,000. My tissue melting weekend, just for one, is 2,400, but you could take about 10 of those because there's so much to it. There's a biotensegrity cupping class that I'm adding into it for your biotensegrity. So once you take that, you'll understand what biotensegrity is. You don't have to use cupping if you don't want to. And if you have cupping, don't worry about it. It's more about biotensegrity. We add in what I call MEPS coaching. This is to help you with your interview skills on figuring your patients out to know where to go with them. We added in our business best practice, which would be about a $2,500 program. Technically, it could be more if we added more into it, but that's the basis of what I've been charging the people that I'm working with. We've got the intuitive listening skills class, which would be about $1,500. We've got Jenna here, who is our resident specialist in concussions, and she has a online class that we're going to include into your class, which is about $400. It's the introductory to it. You can go and take more stuff if you want to, but we're going to include that as well because concussions are so huge and they don't teach anybody about concussions. Nobody knows what to do. You may not want to actually do the treatments on concussions, but you should at least be able to recognize the symptoms. When somebody comes in, you're going to be like, whoa. Because as an osteopath, if you just jump into osteopathic techniques, you could do more harm. And Jenna's going to come in and be like, whoa, back up. You need to understand how concussions work. And we're going to give you that because we think it's a really great upgrade to add into the program. There will be more upgrades coming. So that would come to about $25,000. Now, this is where I'm going to bring Jenna in because we have been in this for a long time. I've been doing this for 30 years. Jenna, I think you're in around 20, aren't you? You've been doing it for a while. And how much money have you spent in extra credits trying to just position yourself in this field?
Oh, I have not.
Like 100 grand probably, right? Like,
Yeah.
isn't
Yeah.
it nuts? Like there is no roadmap. Like it has been all over the place.
Mhm.
It's horrible. Like it's and now maybe 15 years ago when we were doing it, the economy was set up that you could afford it, but now there's so much new stuff out there, you don't even know what to do. And it's crazy. So what we want to do is we want to make this affordable for you and get you on that right path because there's so much that you can take and we want to help you understand what are my options out there and like how do I even go about doing this. So we are going to try and save you a lot of money, and that may sound like a lot of money. It actually really isn't. Like this program is probably going to save you more than that. So if I were to give you just a straight up discounted price and put it as the manual osteopathic practitioner, that would be a $15,000 program. And so this is where everyone's saying, like, you have to charge $15,000. And I said, all right, I can see that. I understand that. But if I do that, then I now have to go down the road of registering with every single province. I have to follow what everybody else is doing. And I don't want to do that. I don't want to follow what everybody else is doing. So, what I decided to do is do it a little bit differently that works more for you as a therapist and less appeasing the governments, but still being able to give you your manual osteopathic practitioner and having a billable insurance. So, what I did is I discounted it a little bit more. I discounted it down to $8,000 for the program. And then technically it's charged by modules. So then that way, as long as it's under $1,000 a module, then we can do it this way. You can still get your manual osteopathic practitioner. You can still get an extra billing number if you want to, or you can be an osteopath who works under your massage therapy license. You can do either or, it doesn't matter. Why did I do it this way? Because I am not going to waste a ton of time. I'm not going to give you work that you don't need to do. I am going to give you a very strong foundation, very strong business foundation, very strong listening skills. Because as Jenna was saying earlier, they teach you all these techniques. Well, most of them you're going to forget about anyways. And then you're going to go and you're going to take more courses. So we're going to create a really strong foundation in that if you didn't want to, you wouldn't even have to take any more courses because your listening skills are going to be that good. But at least you're going to be able to say, okay, what kind of classes do I want to take from here? And what kind of a therapist do I want to be? And let's create a really good business plan. The way we're going to set it up is all of the online classes will be available at your own pace. The in-class are going to be in different locations across Canada. So right now, I have a cohort starting in October in Calgary. Actually, I've got three in Alberta. So I've got one in High River, Calgary, that's going to be starting in October. And I've got a group in Grand Prairie that I'm going to be going up working with. And I've got a group in Medicine Hat that I'm going to be starting with. In Ontario, I've got a group in Ontario that I'll be starting the in class likely, probably in actually, it could be as early as November, December, but we're just still trying to gather it. So the way it's going to work is all of the online classes are going to be identical. You get access to the online classes. You get put into a community. So everybody within the school is in one community where you guys can talk to each other, where you can bounce ideas off each other, where all of the lectures are going to be hosted on. Then you go in and you take your in class to whichever spot I'm offering it. So if you say, hey, I want to sign on, but there's no one in my area, no problem. You can fly into wherever we are. Or, which is what I've had a couple people do, is say, well, how many people does it take to get you to fly in here? That number is 8 to 10. It's about 10, depending on where you are, because I've lowered the cost so much that I'm going to need a minimum number of students if I'm going to fly in. So if there's not enough students, you may have to fly into where we are for the in class. But here's the great thing. There's not that many in classes. You've got 4 days of tissue melting. You have 4 days for cranial, 4 days for visceral. Then you've got 4 days for integration. We actually do the muscle energy online because it's easier to actually learn on the videos than it is in class because I do it very structurally based. And then you come in and the 4 day integration, we just practice all of it towards the end. But what we do is we start off with the tissue melting because that's your biggest assessment. And if you have tissue melting down, if you have your assessment down, then when you learn the other techniques, you'll know how to implement them. If you've already taken cranial or visceral, you'll take tissue melting and go, oh my gosh, like what I was doing is exploded. Okay. We're also going to be adding in, by request from some of my students, intuition training on, well, how do I really tap into my intuition a little bit more? Because the more you can tap into it, your results are going to go from here to here. They're going to be huge because you're tapping into a whole other energy field. So we're going to be adding in classes on energy matrix as well. If you sign in early, you will have access to all of these. In the future, there's going to be your base tuition, and then you're going to have some electives, and then there'll be like a la carte classes that you can attend. So, because we're just starting this, because it's still in the foundation, we are actually offering a discount to jump in right away. If you jump in by the end of September, we're going to give it to you for $6,000. Okay. So, here's what we did. If you're like, okay, that's still too expensive and this sounds like a marketing thing, yeah, no worries. I hope you learned something new today. But that's not what this is. What this is if this is something you've always wanted to do, you're going to go, this is the time to do it. Like it's now or never. If I don't do this now, I'm never going to do it. So that's where I'm at for this price is to say, okay, you're like, oh my God, something like this doesn't come along very often. I'm going to jump on it. Then jump on it. Get in right away, get started. If you're like, okay, well, I want to jump in right away, but I've got a bunch of stuff I need to put together and I've got to get some money together and I can't do it by the end of September, that's not a problem. Just get in touch with me and we'll have an interview. We can get all of the process started. We'll figure out where you're at, what you want to do. Can we position you in? And would I be able to offer that discount? So I'm not closing the doors entirely, but once those doors are closed, if you come back to me in October, November and say, hey, are you still doing this? I don't know what I'm going to be doing then because the cohorts will have already started. So, I've got to keep things a little bit structured. So that's kind of how we're going about it. So you're going to have a program with online lectures where you can go in at your own pace. You've got 5 modules in total at 4 days. Now, the fifth one is optional with exams. So it's going to depend on where you're at. If you need that extra time, we incorporated it in there. That being said, if you're struggling, we'll work with you until you pass. Like, we're not going to let you get through the cracks and not be able to do this because I have complete confidence in myself that I've taken every student through this and they get it no problem. So I'm not concerned about that. You will be able to do this work as long as you put in the time. You're going to get credit for completed certifications. Now, because I'm discounting it, you don't get credit on the price, you get credit on the time. So in the future, when I'm charging, full price for this program, yes, I will discount you for your previous education. But for right now, it just means, hey, I've already taken cranial with Upledger, I've already taken visceral with Baral. I'm going to say, send me your certifications, and you don't have to do the in class. You'll get credit for that. You'll get the time credit. But the price is the same for everybody jumping in. At the present time, we are looking at having classes in Toronto, Calgary, Grand Prairie, and Medicine Hat. I am talking with other groups, but probably won't be until 2026. So if there's somewhere else, if you've gotten a hold of this, or if you're like, hey, I've got a group of 8, would you fly out to here? If I have the time, yes. And I can't guarantee when that'll be, but it's definitely something I would consider. Just shoot me off an email. So that is the program in a nutshell. So this was time for questions and answers. Jenna, do you have any questions that you think some of my listeners might be asking before I close this off?
Yeah, so something that you had mentioned a bit earlier about associations. So for the individuals that already know they want to bill as an osteopathic manual practitioner, at the end of this, what association would they feed into? And do you know what insurance companies that association has contracts with?
Okay, perfect. Yep, that's a good question because I did have that on another slide that I slipped past. So there's only actually 2 associations for at least in there are at least in Canada. There's only a couple of associations that are accepting type 1. And one is Samota and the other one is ACMA. Those are the 2 main ones. There is in Ontario an Ontario association for type 1. So those are really the only 2 right now that are accepting them. So I've been approved with ACMA. I can provide their website. They have a list of all of their insurance companies that they cover. There is some that they don't. Now, Canada Life is one of them, but see, the Samota also does not cover Canada Life. So if you want some of these insurance companies, you're going to have to go through the 4-year with one of the other associations that are covering it. However, when I said it was political, I wasn't kidding. You can do that, and those associations can change their mind whenever they want. It's not like being registered as a massage therapist where you're registered with the province and all of the associations, everything's being covered. In fact, I am noticing in Alberta, because the massage therapy isn't registered in Alberta, and there are 4 main associations in Alberta for massage. And I have started hearing that some of the insurance companies are not covering some of the associations. So this is what's happening in the world is because it's a non-registered, it's the wild, wild west. And it's a little bit crazy as to what's happening. And it's not looking like registration is going to happen anytime soon. They did, they have accepted it in, I think it's New Brunswick, but they haven't implemented it yet. And the massage, they've accepted it in Saskatchewan, haven't implemented it. Alberta is in the process of getting a college in, but who knows when they'll implement it. It could be 20 years. So when you don't have that regulation, there's a giant question mark as to what's going to happen, and nobody knows. So for the non-massage therapist is a very difficult situation to be in. Would I recommend you become a massage therapist? There are some associations that are pretty covered by almost anybody in 4-year programs in Ontario, but there really isn't any anywhere else in Canada. So it's another reason why ethically I've decided to work with a massage therapist because they already have, they've already got that registration other than Alberta. However, with ACMA in Alberta, that's who I'm with right now. I have yet to have anybody whose insurance isn't covering it just because I just haven't had anybody with Canada Life, to be honest. And if they do, they're like, I'll just pay for it in a pocket. But I've also got my massage therapy in there as well. But I don't find that that changes anything. In fact, I came home here for the summer in Ontario, and I don't have my massage license in Ontario anymore. I retired from here. I just have my osteo and called up some of my other clients. I called up some of my clients and said, hey, I'm here for the summer. And honestly, all of them just paid out of pocket. They're like, yeah. I got a question here about NHPC, natural health practitioners. NHPC is actually looking at getting osteopathy approval. They're not there yet, but when they are, that is definitely one that I can look at also being able to become a member of for osteopathic. Now, here's where it gets a little bit tricky is if you want to do massage and osteopathy, what's going to happen is you're going to pay for your registration for massage and your insurance, but you're also going to have to pay for a registration for osteopathy and insurance. So you're tacking on likely about an extra $700 a year for a dual designation. So you're going to have to decide if it's worth it to have two. So for with Samota, it's the same thing. They do give you a bit of a discount for both, but it's not huge. But you're looking at about an extra six, anywhere from $400 to $800, depending on who you're with, to have that dual designation insurance billing. Does that answer your question about NHBC?
Yeah, it does. Because I'm currently with CRMTA and
Okay.
I have to renew come October. So I was like, well, if this is a good time to renew, should I switch over to Samoda or NHPC?
If you like who you're with, I wouldn't switch just yet because the reality is they're not going to cover both at the same time. You'd have to,
Yeah.
right? You'd have to, if you, that's with Samota, you pay, I think it's around $400, and that gives you your insurance and your massage registration. Then they're going to say, if you want to be an osteopath, it's another $400. So whether it's $400 with them or $300 with another association,
Yeah, CRMTA doesn't even consider
no.
osteo. So I was looking into switching since we started talking.
Yeah, so in Alberta, Samota does offer it. The issue is with Samota is and I've contacted them and they are very excited about me starting up this school and they've given me everything to become to get registered with them. It's expensive. So for the time being, what I decided to do is say, okay, I could charge the $16,000 and go through that path, or I could just discount it and take my time and give massage therapists that ability to at least get that education and get practicing.
Okay, that makes sense.
Yeah.
Yeah, I was
As long
planning
as, yeah. And then the insurance between Samota and ACMA is identical. They pretty much cover all the same stuff.
yeah, I was just looking into switching anyways because CRTA doesn't really offer much support at all.
Yeah, yeah. It's and that's the thing, right? Is it's like you say, it's Alberta, it's the Wild Wild West. It's still a bit of a crazy situation happening over there.
Oh, exactly, because we don't know when we're gonna get regulated, right?
Oh, it's a minimum of 3 years up to however long. Because when you create a registration for anything, whether it's osteopathy, whether it's massage, there's a process that has to happen. One, all of the associations for that province need to come together and agree on something. That's the first thing. So in Alberta, what they did is they just mimicked Ontario's CMTO and they've just cut and paste. Here we are. The government does not pay for this. So whoever it is that's lobbying to put this into the government, that's who pays for it. So what they're doing is they're asking members to say, hey, over the next 5 years, pay $200 a month And then that way you'll have paid $800. Everybody else is going to have to pay the $1,200 because that's how much it's going to cost once you're registered. Is instead of it being an association for say 400, you're looking at about $1,200 to become registered plus insurance. It's going to get really expensive. And then you want to add on another osteo on top of that. That's a little bit insane, right? Which is why I'm like, you can get that association if you have enough clients, but if you don't want to, you don't have to. You can say, hey, I'm a manual osteopathic practitioner and I bill under massage therapy. If you're not a massage therapist, then you have to get an association that only does osteo. And that's where Jenna was going because she is well adversed in how crazy it is in British Columbia. It is nuts what's happening over there. So each province is a little bit different as to what they're doing in regards to osteopathy.
Okay, makes sense. Yeah, maybe we'll talk
Yeah.
more later then.
You send off whatever questions you have. Um, I really wanted everyone to understand this because if you're going to go to one of these other schools, you could go to, like I say, there was that school up North Alberta that NMOS is, they have their own association. Like a lot of these schools have their own associations and they only accept their own schools. So if you want to get registered, you've got to get all these associations together, get the government to agree to it. But then whoever's bringing it together has to pay to write the laws in. So it's just not going to happen. And then what's happening is insurance companies are saying, okay, well, we're okay with these associations, but not these associations. And it's just a little bit on the challenging side. However, in Alberta, the four main associations, I think MTAA has the strictest, there's a lot of schools that they don't even accept into their association. They probably
Yeah.
have they pretty much have all the insurance companies. I think NHPC has, I think they're still pretty good. I'm not entirely sure. I'm not entirely sure. I just did hear that there was one association that one insurance company said, no, we're not covering that one anymore. So
Yeah, with MTAA, they don't accept Macamee College.
yeah, so they're very particular as
Yeah,
to yeah, who they accept, which is kind of silly actually, because out of all the schools, Macamee is like I can't see why they wouldn't. But
right? It makes no sense.
no, it really doesn't, right? So that's where the frustrating part is, but I think NHPC, I still think that they're doing pretty good and they're doing pretty good work. And I know that they want to add in, but I know Samota covers absolutely all of them. I don't think there's any problem with Samota. I think
Okay,
that,
sounds
yeah.
good. I'll check them
Mhm.
out again.
Yeah, absolutely. Any other questions that you've thought about that you would like maybe me to cover that anybody else too might be curious about? Nope. Okay, so good. Alrighty, so that was like, holy cow, 2 hours, very, very long. But if you do have any other questions after this, definitely get in touch with me. It's hopefully not more confusing. Hopefully it's like, yeah, that makes a lot of sense. Yeah, like, think about what it is that you'd like to be able to do. Where is it you want to go? And that's, I think, I'm going to say, if I were to step aside and let's put all the schools aside, let's be like, let's put all of that aside. Let's just take a look at your situation for the moment. And I think most massage therapists are just sitting here going, I need to make more money. I need to do some work that's not going to hurt my body. And I need something that's just a little bit more structured and cohesive so that I'm not always searching for more techniques. And I want to set myself out. I want to set myself apart. So where I found most of the massage therapists landed is okay, if I want to position myself, say in the clinic I'm working at, and say I'm going to charge, well, probably most massage therapists charge 100 an hour. Most osteopaths charge 100 for half an hour. That's the biggest difference is to say, okay, I'm working at this clinic. I'm either in a 60-40 split, 70-30. They're pretty rare, to be honest. And I want to make more money. How do I do it? Well, you're going to have to charge more money. It's the only way around it is you're going to have to charge more money or find something else to add into your practice, like sell some products. So you're like, okay, so I'm charging $100. I could easily charge $130 an hour and say to my boss, I'm keeping that extra $30. Okay, then now we're talking. So, because that's an extra 20 people a week would be an extra $600. So things are adding up really fast. That's an extra $24,000 a year, just like that. Just because you can say, I'm charging $130. And if they say, well, we don't want to do that, then we're going to help you find somewhere where you can. But we're going to make sure that it's a no-brainer where they're like, oh, yeah, of course. We'll show you why you should charge more. We'll give you the confidence to be able to do that and how to negotiate that with your bosses. So it's really important that you do not take this education and keep your prices the same. That is going to be the worst thing that you could do for yourself because the energy is going to be a mismatch in energy. You're going to be way above everybody else. You should be getting paid to be above everybody else. That's the biggest challenge with massage school is everybody comes out, they learn the Swedish massage. Everybody takes some courses and they kind of go up, but they're like, well, why would you charge more? You have to be able to answer that question. As an osteopath, you can say, I charge more because I get to the root cause and I get these results. All right, let's give it a whirl. And then word of mouth goes and you're set. So whether it's an extra $20, $30, $40, we're going to get you positioned depending on what it is that you do. Some therapists like to add shockwave into it. Some therapists like to add, other modalities into it. Some like to, like you can justify a little bit in there. You can say, no, 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 I'm only working on, say, this type of treatment. Like you can niche yourself, but we're going to position you in an area that you can say, well, I specialize in XYZ. That's why everybody comes back to me. This is how I'm different. This is why people pay me the big bucks. And that is key. Now, you could do that without taking any osteopathic program. You could go out and take cranial, you can take visceral, you can take a whole bunch of other stuff and then say, well, how do I position myself? You're going to find yourself that you're in the gap that I was in, where, well, hold on a second. And that comes into your approach, your assessment, the structure, and how you are, what you're bringing to the table. There's got to be something that's fundamentally different in you than everybody else. And what you're going to notice in the tissue melting class is we're going to pull out what we call your superpower, your intuitive superpower. And everybody has something that's very unique about them. We're going to find it. We're going to light that spark and we're going to explode it. And we're going to teach you how to take it and monetize it, basically, because it's something that's so unique in you that you get those results. Does that make sense? It's pretty cool, actually. It's a lot of fun too. Alrighty, well, thank you so much, ladies, for jumping on for me. It definitely helped, getting through some of this a little bit faster. I'll be sending this recording off to all of my other attendees that signed up, so I'll get this uploaded and sent off as soon as possible. And if you have any other questions, definitely just shoot me off an email, send me off a message. If you want more information about the program, if you want just a one-on-one to be like, hey, I don't know if it's right for me, just yeah, get in touch with me. We'll set up a call, we'll talk about it. And for anybody wanting to jump in that's in the Alberta area, we're going to be starting in classes fairly quickly. For those who say, well, I'm not sure when I want to jump into the in class, it's not a problem. You can get started on the recordings and practice at home. Then once you come to the in class, it's about implementation. You'll be amazed actually if you sign on and you start doing the recordings, you might be like, I don't even need to go to the in class. And I might be like, you might not need to, but you have to if you want your certificate. You want to be able to, say, hey, I'm a manual osteopathic practitioner. You're going to have to do the in class. You're going to have to send in your notes. You're going to have to do the work. But technically, should a therapist decide, they could just watch all of the trainings, go and practice it and do it. They're going to be that in detail. They're going to be that helpful. I want to make sure that everybody succeeds. All right, so I'm going to let you guys go. Do you have anything else that you want to add, Jenna, before I go?
No, I don't think so. I mean, I think you've pretty much covered just about everything.
It was a lot, right? In a 2 hour period, like, holy cow.
Yeah,
Yeah.
um, I can't imagine anything else. Just like in a more general sense, not necessarily to do with this particular program, but I think personally, I think it's important for people to decide where they lean, whether it's cranial osteopathy or structural osteopathy. That's more the British terms, I suppose. And to be able to explain that to people when they come in for their session so that you can feel grounded in your approach, how you explain that to the person so they know what to expect. Because as you said, osteopathy is not regulated in Canada. So you could see 5 different osteopathic therapists, and you're going to get 5 completely different treatments based on if they're more structural, if they're more cranial. There's a person in my town who does predominantly energy work and Bach flower remedies. Um, he does family systems clearing, like all sorts of stuff. So, and there's nothing wrong with that. Like that, I think that is the beauty of not being regulated in a sense, because it allows the uniqueness of each osteopath to really shine and do what they do best. But I think as the therapist, it's important to know where you align and how you're going to integrate that into their treatment so that they know what to expect. Because I'll get people who come to me from um, like they're like, oh, I saw someone in Halifax and I saw someone in Montreal and I saw somebody in Vancouver. And then it's like, okay, but here's how I practice. Here's the description of how I practice. Here's what to expect in our session together. Here's how I personally blend the two approaches to osteopathy, with the understanding that maybe that matches what they're looking for, and maybe it doesn't, and that's also okay, because I also know lots of cranial osteopaths that I'm happy to refer people out if that's really all they want. So I think that's part of the integration piece, is really feeling aligned with your approach and what people expect. And it calms people down when they come into your office because a lot of them don't know what to expect. And it kind of just brings that ease. I don't know.
Oh, I love it. No, you said it perfectly, Jenna. And that's the hardest thing. That's that integration part. If you don't know what your approach is, you're lost.
Yeah, how do you integrate it? For sure.
Yeah. And each person's going to be just a little bit different.
Yeah.
And that's why that's what they don't teach you in massage. And quite frankly, they don't, most massage therapists, even with osteopathy apart, that's where they're at now, is they're just saying, and oh, well, you're coming in and you still have elbow tendonitis. Oh, well, let me try this technique on elbow tendonitis, or let me try this technique on elbow tendonitis. But that's not how the body works. So we need to teach you how the body actually works so that you can say, whoa, hold on a second. It's usually, if it's chronic pain, it's usually not coming from where it hurts. That's unless it's really point specific. Tissues do heal. If they're not, if the pain is still there, you're going to have to look outside the box. And that's why the osteopaths get paid more money, because they look outside the box and go, all right, I can tweak it this way and it works, or I can tweak it this way and it works. But if your patient comes in thinking they're going to get a deep tissue massage and you come in and start moving their organs around, they're going to go, what are you doing? You need to be able to explain that, why, and what you would expect. Yeah. And we absolutely teach you how to do that. And that's what I'm doing for other osteopaths and other massage therapists, is I mentor them on how to do that. So I thought, well, why wouldn't I just have a whole program for people? So then that way it's like, you don't decide to go and take a $16,000 program and then come in and go, hey, Denise, will you work with me on how to do this? And I'm like, well, this is going to take us a while, right? It's way easier if you can actually do it as you go. Yeah. Awesome. All right. Well, I will let you guys go and enjoy the rest of your Sunday. And thank you so much. Really appreciate it. And if you come up with anything else, yeah, definitely get in touch with me.
Sounds good.
Okay.
All right.